Bismillahirrahmanirrahim. Healthy babies need healthy mothers. My supervisor, Professor Dr. Saira Afzal, provide me an opportunity to write a systematic review, and the title of my systematic review is Risk Factor Associated with Low Birth Weight Babies in Pakistan, a systematic review. This is the learning outline of my today's presentation, or the headings of my systematic review. Introduction. Birth weight is most crucial determinant of neonatal and post-neonatal survival. Low birth weight babies are more prone to die in first year of life than healthy babies. Globally, out of 145 million live births, 20 million babies are low birth, and mostly in developed countries. Prevalence of low birth weight babies is reported as 31% in South Asia, 7% in East Asia, 14% in South Africa, and 15% in Middle East Africa. According to demographic survey, the prevalence of low birth weight babies in Pakistan is almost 16%. Nearly 15% of babies worldwide are born with low birth weight. Objective of my systematic review. The main objective is to identify the different maternal risk factors associated with low birth weight babies in Pakistan. And in the methodology section, we conducted a systematic literature review, including articles published between January 2011 and June 2022 to discover and evaluate the maternal risk factor associated with low birth weight babies in Pakistan. The methodology includes a review of relevant published articles found with the help of database like PubMed, Medline, Google Scholar, and ParkMedinet. In each database, the following keywords and the specific heading with Boolean operators are used, like maternal risk factor, low birth weight babies, underweight babies, pregnancy risk factor. And Prisma 2020 flow diagram is used, and it is also shown in my next slide. This is the Prisma flow diagram, and the record identified through these databases are total in number. There are 250 from Google Scholar, 222, PubMed 25, and ParkMedinet 3 articles, and records after the removal of duplicate are 222 in number. And then we, after screening of all these articles, the number which is remaining is 140, and records excluded from these 140 is 95 due to just abstract RCT study design, case control studies, or case reports. And then we retrieve only 45 articles, which are full text articles that are assessed for eligibility. And from these 45, again, we exclude 25 studies on the basis of insufficient reporting of measuring outcomes. The total number is 18, in which the prevalence of low birth weight babies were not given, that are 5 in number, and the language other than English are 2 in number. And from these 45, the 25 articles are excluded, and then only 20 articles remaining that are used in this systematic review. Inclusion criteria of for the selection of my articles, only cross-sectional studies are included and full text article. And in the exclusion criteria, case report, case control studies, RCTs, and case studies are not included. Papers in other language that did not meet the inclusion criteria are not the part of our study. This is the results section, in which The data of these 20 studies are depicted in the form of table. In number 1 column, this is the serial number of all articles and author and year. And then there is the title of article, place of study in different cities of Pakistan where the study is conducted, study design, and then in the last column there are maternal risk factors that are identified in different studies, and this is the reference number of these studies. So you can see that, like in our first study, low birth weight, frequency, demographic profile, and association with maternal risk factor at a tertiary care teaching hospital. This study conducted in Kharia, Pakistan, and the risk factor that are identified is maternal age, pregnancy-induced hypertension, anemia, irregular visit of antenatal visit or no antenatal visit. So these are all the title of my studies, and these are different cities like Karachi, Rawalpindi, frequency of low birth weight babies in term pregnancy and its association with maternal risk factor. This study conducted in Rawalpindi, and the risk factor that are identified is maternal age, anemia, hypertension, or antenatal care. Maternal anemia as a predictor of low birth weight babies in underdeveloped rural areas of southern Punjab. This study conducted in Multan, and the risk factor that are identify maternal age, anemia, socioeconomic status, or multiparity. The association between iron deficiency anemia and adverse pregnancy outcome. This again study conducted in Karachi, and the risk factor that are identified is hypertension or anemia. These are another 5 studies. Low birth weight babies at term and contribution maternal risk factor in community-based hospital, Karangi, Karachi. These are again cross-sectional study. Teenage mother, anemia, and hypertension are the risk factor. So these are my studies that are used in this systematic review. Maternal risk factor contributing for low birth weight babies at Tertiary Care Hospital of Lahore. This is conducted in Lahore, and the risk factor that are identified maternal age, hypertension, BMI 25 kilogram, and there no antenatal visit. Severity of maternal anemia and fetal-maternal outcome at a tertiary care hospital. The study conducted in Jamshoro, Pakistan, cross-sectional, and the risk factor that are identified: maternal age, parity, anemia, education. In this study, the risk factor is maternal age or level of hemoglobin, gestational age or the BMI of mother, maternal age and maternal anemia, again risk factor. These are last 5 studies. So the total number of these studies are 20 in number, and that are the data which are extracted from these studies are represented in the form of table. Results. All the studies included in this review were cross-sectional, and the total 2,000 pregnant women were included in analysis. The included studies reported sample size ranging from 150 to 2,810. All studies conducted in different cities of Pakistan. Out of these studies, 7 are conducted in Karachi, 3 were conducted in Rawalpindi. Remaining studies conducted in different cities like Kharia, 1 in Multan, Hyderabad, 3 studies in Lahore, 1 in Bahawalpur, 1 study in Jung, and 1 in Jamshoro. This is the table in which the outcome of this systematic review is shown, and there are 9 outcomes that are identified in these studies. And the number 1 is maternal age, that are identified in 50% of our studies, almost in 10 studies. And the age group that are most prone to low birth weight babies are adolescent age group, in which the age is 13 to 20, and the middle age group 21 to 30. And then there is a maternal anemia is also identified in 10 of our studies, and the moderate category of anemia in which the hemoglobin level uh, range from 8 to 10 gram per deciliter is most prone to low birth weight babies. And then there is a level of hemoglobin which are identified in 8% to 25% of our studies, and the level is 8 gram per deciliter to 10 gram per deciliter. And then the range of hypertension, this risk factor identified in 8 studies, and the range of blood pressure that involved with low birth weight babies are systolic blood pressure 150 and diastolic 100 Hg. And antenatal visit identified as a maternal risk factor in 5 of our studies, and the visit that are women having all in their trimester are less than 3 or there are no visit. And multiparity is identified in 4 of our studies, and the parity is more than 3. Lower BMI of the mother is also a risk factor for the low birth weight babies, and it is identified in 4 studies. And the BMI less than 25 is involved with the low birth weight babies. And then in the last, there are 2 risk factors: low socioeconomic status or education status, mostly illiterate education status. It is identified in 3 of our studies. Income less than 25,000 and illiterate or primary education is a strong associated factor with low birth weight babies. Again, these outcomes are represented in the form of pie chart in which the percentages are shown. Now comes the discussion section. This result was also significant with the study in which secondary analysis of data done, which was taken from demography and health survey of 10 developed countries, and they highlight the advanced maternal age group 30 to 49 years and adolescent age group was strongly associated with low birth weight babies. These results were also consistent with the randomized control trial conducted in University of Benin that the moderate anemia in third trimester of pregnancy and the level of HB 9 to less than 9 are the higher risk of low birth weight babies. The results were also significant with the secondary analysis of WHO related to preeclampsia and eclampsia in facility-based cross-sectional studies in which the systolic blood pressure of more than 150 and diastolic pressure more than 100 was the cause of low birth weight babies. And this finding was also consistent with the previous study where the frequency of low birth weight babies was significantly higher among mothers with the BMI range from 18.5, and another similar study described the lower BMI double the probability of low birth weight deliveries. The strength of my systematic review: due to strict following of PRISMA guideline, the current systematic review reported the representative estimate to ease the accessibility of evidence for concerned policymaker. The categories of all maternal risk factors which are strongly associated with low birth weight babies are comprehensively reported in this systematic review, and furthermore, 2 authors independently extracted data to lessen the probable risk. And in the conclusion section, health professionals should screen and consultate pregnant mothers who are at risk of having infants with low birth weight babies and ensure that women have access to essential health information on the cause of low birth weight, public education and awareness on how to carry a healthy pregnancy. Women should be linked to the appropriate maternal health services, including antenatal care and nutritional counseling. These are the references of my systematic review, and thank you.
Thank you very much, Dr. Naira. Very good presentation, and I hope everyone has learned a lot from your presentation. Now, this house is open for critical appraisal. I would invite first Dr. Amber and then Dr. Khansa to please have your comments on these slides, and then this house will be open for question and answer session. So, first to Dr. Amber.
Assalamu alaikum. It was a very good and nice presentation, and it's starting from the title. The title was good and precise, and also it labeled that it is a systematic review. Also, the Prisma guidelines was followed, and Dr. Naila tried to address all the points starting from the title to the end. So, the most important points that are highlighted in this systematic review first was that she gave a brief background, and later on, her search study was quite explained in detail, stepwise, and the databases, the keywords that are very important to mention, also the mesh keywords, they are also very important to mention. So they were stepwise, every step was there. Next, how many it is also very important that whenever you are giving the selection of the studies or your selection criteria, you always start from the total number, as she started in her Prisma flow sheet. So her flow diagram was having a good inclusion and exclusion criteria, but if she could have added a little more why she was including only cross-sectional studies, a little explanation of if there was introduction of any bias and how she handled it, would have been much will increase the importance of the value of this systematic review. And later on, the result section was simple, precise, and to the point. However, if she is using prevalences, then meta-analysis can also be a part of this systematic review and can strengthen it more. However, the result section she has presented was relevant to the objectives and the purpose of the systematic review. So they were in line and they were explained very well. Later on in discussion, the reference to the other studies were also very relevant, and add the limitations along with the strengths would add to the value of the systematic review. So these are points from my side. I would like Dr. Khansa to add more, please. Thank you.
Thank you, Dr. Khansa. Would you please go ahead?
Assalamu alaikum, madam. First of all, Dr. Amber has beautifully explained about various sections of systematic review. I only have 2 to 3 points. First of all, as we already know, these risk factors associated with low birth weight babies, I only had one concern regarding the risk factor. Okay, if Dr. Naila have divided these risk factors stratified according to region, for example, they labeled in last 20 to 23 studies in developing or developed country, if they stratified the low birth weight prevalence or low birth weight babies according to stratification, then it should be very helpful for readers to easily identify the risk factor. And third is the methodological quality, validity, and risk of bias are very important to measure. If she should include or would include a risk of bias assessment or quality assessment, then it should be very good critical appraisal. So I have these 2 to 3 points. If he can add, then it would be more better systematic review. Quality assessment.
Thank you very much. Thank you. Anybody has any question? You can write in the chat box if there is any question. Okay, thank you very much everyone for joining in. And I hope with these presentations, everyone is very well versed with systematic reviews. And today we would discuss it in further detail. Thank you very much everyone. Allah Hafiz.
Khuda Hafiz, ma'am.
Allah Hafiz.